Ed Morrissey from Hot Air, here with Mary
Powers.
Mary Powers.
Yes.
I'm really good at show prep, as you can see. Mary Powers, Students for Life of America at studentsforlife.org. And we're going to be talking with Mary in just a moment about a study that they have on university health plans. Before we get there, though, I want to talk about a couple of big controversies in the abortion industry. First, you have the case in Philadelphia of Kermit Gosnell, who was allowed to operate maybe the worst clinic in the Western world in terms of medicine. Are you surprised that this has not gotten more attention in the media? Because I'm actually shocked. This is a man who, if the grand jury is correct, this is a man who's a serial killer who was keeping body parts as trophies in his office. I mean, this is just ghastly. You would think that something like this would launch a million different, primetime television shows.
Yeah.
I'm seeing nothing on this.
Yeah, it is really shocking that, we haven't seen a lot of this in the media, and I think it's because a lot of them don't want to pick up the story because it's happening across the country. I mean, this is just one example of, a late-term abortionist who's acting illegally and has a clinic, the way that Gosnell had his clinic. So it's definitely happening across the country, and people just don't want to pick it up because it has to do with abortion, and people don't want to talk about it. So.
Is it that people don't want to talk about it because it has to do with abortion, or that the media doesn't want to cover it because they don't want to make the abortion industry look bad? Because I think that when people hear about this, they want to talk about this. I've been writing about it at Hot Air, and I will tell you, to be fair, the Philadelphia media has been talking about it, has been covering it, so it's not that there aren't media reports, it's not that these media reports aren't significant media outlets. Philadelphia Inquirer, Pittsburgh Post-Gazette, local television media has been doing a good job in Philadelphia covering this case. But unlike other cases, none of the national news outlets seem to want to pick up the story and tell the story.
Yeah,
and I think that's deliberate.
It's really only been like Fox News and a couple other outlets that have really picked it up, and I think they should be picking it up. It's a huge story, and there's clinics like this again across the country that the government's getting complaints about it, and they just aren't doing anything about it. So, and I think it's a little bit of both, where they don't want to pick it up because it has to do with abortion, but also they don't want to expose the truth about Planned Parenthood.
I think that that's very much the case. Talking about exposing the truth of Planned Parenthood, the second controversy, which is the films coming from Live Action. The great organization, Lila Rose is the leader of that. LiveAction.org. The undercover videos at Planned Parenthood clinics. Now, prior to this round, Mary, they were doing undercover videos at Planned Parenthood clinics that took a look at whether or not these clinics were reporting incidents of, or evidence of child abuse and exploitation, in the sense of, a girl goes in there and she's saying she's 14 years old, she's got a 31-year-old boyfriend, that sort of thing.
Yeah.
And that was bad enough. But they kind of stepped it up this time around by sending in a couple that's pretending to be a pimp and a prostitute and talking about running sex rings with children, 14 years of age, 15 years of age. And there's a requirement there to report that type of exploitation. Now, what you don't see is whether or not if these clinics individually reported that. And there's been a couple of these cases where it didn't look like there was a ton of cooperation, just more like answering a question and letting it go at that. There are also tapes here that we're seeing where they're giving advice on how to hide the sex trafficker, giving advice on how to. One of the clinic workers said, "Well, all you got to do is claim that you're her guardian, and nobody will ever ask any questions."
Exactly, or say that they're a student, and they'll get special discounts.
They'll get special government-subsidized discounts on their abortions and their. How disturbing is that?
It's very disturbing. It's crazy, and it's just kind of like the next step in exposing the truth about Planned Parenthood and what they're doing behind the scenes. And even in the video in New Jersey, the Planned Parenthood director says, "Hey, if you push me some money, we'll streamline the process for you and help you in your business." So it's definitely not an isolated thing. It's stuff that we're seeing across the country, and we work with students every day, and this is definitely something that we see. These are reports that we're seeing, so it's not an isolated incident.
So this takes us to your study, university health plans and abortion subsidies in health plans. Tell us a little bit about what you found in your study.
Well, the study kind of came about because we found out that the University of North Carolina system was requiring their students to have health insurance and then automatically enrolling them in a plan that covered elective abortions. And we worked with students on the ground and with the administration, and we were able to allow or get students to be able to opt out of the health care plan, but they're still automatically enrolling them in the abortion plan. And then also we found that there could be taxpayer-funded abortions through federal Pell Grants, because they're placing the abortion health care under the total cost of attendance for the university, which allows you to get more money from the federal government, and when they give you your education grant, that's where your money goes, is the total cost of attendance. So, we should make this clear. What they're doing is they're rolling it up into the student fees, which are required. Regardless how many units you're taking, if you're taking any units, you have to pay the student fees, even if you are on scholarship. Generally speaking, you have to pay the student fees. And they're rolling it up into the student fees, which can be covered by Pell Grants. Exactly.
And so these, basically what you're doing is you're getting backdoor funding of abortions from the federal government.
Exactly. We've been working with a member of Congress to write to the Department of Education and to see if they know what's going on, and we haven't gotten a response yet. So we're going to be reaching out to more members of Congress, and hopefully we'll be able to solve that issue. But after working with the UNC administration, the UNC students, we questioned how many other universities are doing this. So we looked at the top 200 largest universities in the U.S. and to see what their policies were. And out of 200 colleges, we found that 194 had a school-sponsored health care plan, and 86 of the 194 plans covered elective abortions, and 38 of the 86 schools automatically enroll their students in that abortion health care plan. So it's definitely a disturbing find, and we haven't been really talking about this. We've seen it in Obamacare where they're forcing it down the Americans' throats, but this is something that's been in secret and been forced upon students. So.
And mainly because it's been done at the state level. It's being funded through federal dollars with Pell Grants in some cases, but these are mandates that are done at the state level because these are state. University of North Carolina is obviously a state institution, and I wrote about it when it got exposed at the University of North Carolina, and they ended up backing down from it. The universities require their students to carry health care coverage, and if you can't demonstrate that you have health care coverage, they automatically enroll you and charge you as part of your fees, and this is what happens. And there's two issues in that. First off is the abortion issue. The second issue, and probably somewhat less importantly, is in that context, is the fact that the students are given a choice. They have to buy a comprehensive policy whether they want to or not. And that's wrong as well. So it's wrong on a couple of different levels. And then on the third level, you're paying for all of this because Pell Grants are applied to student fees in most of these instances.
Exactly.
So Mary Powers, what's coming up next from StudentsForLife.org on this issue?
Well, we're going to be, again, working with members of Congress and working with students on this to try to raise awareness on their campus. So definitely watch for that. And
how can people help you out with that? How can people help you with that mission?
Well, basically, if you go to noabortioninhealthcare.com, you'll be able to read the full study and see all the schools that are covering abortion healthcare plans. And so if you're an alumni of one of those universities, if you're a parent of a student at that university, or if you're a student at that university, definitely call the university, tell them you saw what's going on, you know what's going on, and demand that they remove the abortion coverage from their plan. And if you're a student, definitely contact Students for Life. You can email me at mpowers@studentsforlife.org, and we can get you in touch with people that can help you, and we can definitely help raise awareness on your campus.
StudentsForLife.org. Mary Powers, thank you for being with us today.
Thank you.
I'm Ed Morrissey for Hot Air. More from CPAC coming up.